Self-quarantine is basically just wanted to avoid people for as long as possible. We really did make a good effort to try and find information and get government guidance, and it was really difficult. So there was a lot of questions about what to do, and we were looking and really had no guidance. After 2 weeks, I'm just going to leave and hope for the best.
Sam Zekin's self-quarantine story has become more common as the novel coronavirus quickly spreads around the U.S. The Center for Disease Control and Prevention recommends self-quarantining for the 14-day incubation period of the virus if you're suspected to have contracted it, or even if you have it but don't need to be hospitalized. Even though the CDC has updated self-quarantine guidelines, Sam says that he was unaware of much of that information as he went into self-quarantine, and his confusion has been echoed by many others going through the process. Health and school officials in the U.S. are ad-libbing their own quarantine policies, as guidance from the federal government hasn't caught up with the fast-moving virus. On February 16th, Sam and his girlfriend flew into Italy, but by the time they returned to the U.S. on the 29th, Italy was in the throes of its own intense outbreak. The CDC issued a travel advisory on February 28th.
When we arrived there, we were actually right before customs. They had officials in full suits taking temperatures using an infrared sensor. We were expecting when we arrived back into the country to some type of government intervention or advice or guidance, but we really haven't heard anything.
The CDC says it's currently screening passengers who've been in China and Iran in the past 14 days. And according to the CDC, the general process for returning flights from Italy included passengers receiving a departure screening before they depart Italy to make sure they don't have symptoms, and that screenings are managed by health officials in their respective countries. After returning from Italy, Sam's job still asked him to stay out of the office for 2 weeks.
This has basically been like a soft quarantine, generally trying to be good citizens and avoid running into other people when we can. We've been able to get everything we need delivered online so far. We got dog food delivered. We're getting groceries delivered. So, thank God for that. It could be a lot worse. Most of the people that I've spoken with seemed like they were more concerned than I actually was. But they all thought it was a really good idea, to quarantine and just to be safe. The day after we landed, there was a big, my girlfriend's family had a big party. Her grandmother was going to be there, so we skipped that. My godson's birthday, I actually had a physical appointment scheduled, and my doctor canceled that on me once I told him I was in Italy, so I had to reschedule that.
Sam argues that he's done the best he could with the information he's found in his own research, and for the most part, he stuck to the CDC self-quarantine guidelines. But ultimately, as more people self-quarantine at the request of major organizations, people like Sam say they need streamlined information that's easy to access. Otherwise, they're concerned that they may risk unintentionally spreading the virus further.